diseases to address the stress response. If you're dealing with a thyroid disorder, I really, really encourage you to be your own health advocate, to learn as much as you can about your thyroid condition so you can take action on getting yourself better. Some things that you can do in your very own home include going on a gluten-free, dairy-free, and soy-free diet. We see transformation sometimes in as little as 3 days, where people's symptoms will melt away once they do that. Make sure that you're eating blood sugar balanced. So get plenty of good fats and proteins in your diet. Reduce your carbohydrate intake. You're going to start feeling a lot better. The fatigue is going to melt away, the anxiety is going to melt away, and your brain's going to be functioning much better as well. I also encourage you to take on some stress-relieving hobbies. So whatever you can do to put your body into more of that rest and digest state is going to really, really help you in the long term.
Ask your doctor to check for the following blood tests: TSH, free T3, free T4, and thyroid antibodies. Do you have vitamin D deficiency? This is especially likely if you're depressed during the winter, so have your doctor check for 25-hydroxy vitamin D. Your level should be at least 50. Vitamin D is a critical brain nutrient and has been linked to improvement in cognitive function and delay in many chronic brain disorders. Do you have folic acid or B12 deficiency? Ask your doctor to test your homocysteine and your methylmalonic acid levels to check for these deficiencies. And take an extra 800 micrograms of methylated folate and 1,000 micrograms of B12. Do you have food allergies or sensitivities? Food allergies create a metabolic disorder that can lead to a whole host of mental symptoms, including depression. Gluten and dairy are the major culprits. In fact, partially digested dairy and wheat particles are found in the urine of severely depressed patients, as well as children with autism and ADHD and schizophrenics. These proteins change the brain function and can lead to not only depression, but also psychosis and autism. Do you have inflammation? The standard American diet, or the SAD diet, contains a host of pro-inflammatory foods. To treat depression, you need to get rid of the causes of inflammation and restore the normal immune balance through our food and nutrients, as well as our exercise, sleep, and stress management habits.
Man, the sun came out because I stopped eating gluten, and I'd never heard of gluten before. I didn't know anything about it. But after a few weeks of eating paleo, the depression went away.